to order. October the 16th, 2023. I'd like to welcome the members of the Insurance Committee, Daniel Beatty, Bobby Goins, Mike Hughes, Kim Mason. Thank you guys for being here. And non-committee members, Chairman Cry and Josh Rogers. I'm going to ask at this time Steve Ferreira to lead us in our prayer. And then after that, Bobby Goins will lead us in our pledge.
Father, we're so thankful for citizens in our community here that step forward to do the bidding of you, Lord, to help our city function properly. We are all blessed to be here in this community. So in the name of Jesus, I come before you asking you to give each one of these people wisdom, give them understanding. Let the discussions be peaceful, respectful. Let your will be done in each of their hearts as you speak to them, Lord, to take care of the people that work in this county, in this community, to give them everything that they need, Lord, to function properly and have a good quality of life. And if I may, Lord, bless Israel today. In Jesus' name, amen.
Thank you, Steve. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. First thing I need is a motion to approve the October 5th, 2022 Insurance Committee meeting minutes.
Second.
Got a motion and a second. All in favor? Any opposed? Motion carries. Okay, now at this time we will turn the meeting over to Mayor Davis.
Okay, Mr. Chairman, thank you, and good morning, everyone. What you have in front of you is the explanation of the bidding process. Everyone's gone through this at least once already, but each year, first thing we do is wait and see what the renewal is going to be, working with Sam. And by the way, Sam's here with Cigna, Pam's here with Ocoee Insurance. So what this first sheet tells you is that the renewal that was offered to us by Cigna was a 12% increase. We got that on August the 25th. Anytime we get a renewal that's not real low in percentage increase, we always turn around and tell the broker, okay, go get bids. This year she had actually already sent out the requests on August the 18th. Asking for bids. We didn't change any of the insurance, any of the things in the different plans. They're all left exactly apples to apples as they were last year. When we first opened rids, received the bids, we had a 5% increase. One was like a 4.8 or 9, and the other one was 5%. So basically, out of 3 bids, and we had 3 bids, Cigna, Aetna declined to quote, but we had Cigna, Blue Cross, and United Healthcare. United Healthcare and Cigna were very, very close. So we went back and asked the broker to go back to them and further negotiate without changing any of the plans to see what's the best price that we could come back with. And on September the 26th, we received what you have in front of you today, which is a 3% increase. Now, insurance is always too high. I'll say that with Sam sitting here, but keep it in perspective. Inflation is 6-7% this year, right? And what we have for you today is a renewal with no changes to the plan of a 3% increase. I wish it was 0 or a decrease, but a 3% increase is a pretty good thing to report back to you on. So in a nutshell, that's the gist of it. If you look at the second sheet that you have in front of you, it shows the various prices. We're still offering the 4 plans. Plan 1 is the one that most people are in. Plan 2 is the HSA plan. that we give the employee $50 a month, $600 a year. We put that in their account. Option 3 is just like option 1, except it's open access, which means they can use the other hospital. What's that called? East Ridge and Park Ridge, I believe. Some people want to pay the difference and have Park Ridge and East Ridge in their plan. And then option 4 is the new one that we added last year, which is a higher deductible insurance plan, but it's a free direct primary care to anyone who will take it. Somehow we've got to get more people to understand that option 4 is a very, very good option. It is direct primary care, which means you can go to the direct primary care doctor as many times as you want to. It's totally free. You make an appointment, you walk right in. It works out really well. And also with option 4, they get the direct primary care membership for the entire family. It's a very, very good option, but as you look at the numbers, not many people took it last year. A lot of people don't like change, and that's why we're not forcing option 4 on people, but it is the way to go, especially with a young family that goes to the doctor with snotty noses 3 or 4 times a month. You have no copays. You have basically no copays for your pharmacy. A very good option. So we're still, and then in addition to the direct primary care, you also have a high deductible plan that goes along with it in case there's things that happen. Even young people can come down with cancers and things like that, or even young people can have car wrecks and be in Erlanger for 6 weeks in the ICU. So you've got to have an insurance plan to go with it. We provide that high deductible insurance plan along with free memberships to direct primary care. All of those things are nothing new. They're the exact same plans as last year. The bottom line is we're just here to answer questions and recommend that with a 3% renewal that we stay with Cigna for another year. Having said that, I'll stop and answer questions.
Questions?
No questions. If you're looking at the second one from the county commission point of view, the cost 3% increase is costing $139,000 more than this current year. This is for next year. This plan will begin January the 1st. To the employee, no changes. Whatever they have now, there's no changes. There will be open enrollment scheduled in November once this is approved, and at that time, hopefully more people will consider option 4. But nonetheless, all options stay the same. They won't have any changes in any of their coverages whatsoever. The only change is to the county, which is the $139,000 or 3%. What can I say to cause questions? Because I don't want a million questions, but I want some questions because I want to be able to tell you more of the things that I hadn't thought about. Bottom line is, even though you're told by people every day, why don't we bid it? It has been bid. We were offered to renew at 12%. We took bids. We got them at 5%. We further negotiating and got them at 3%. So now what we have for you is a 3% renewal after going through a very extensive bid process. Yes, Commissioner Hughes.
Mayor, I know that several years ago I spoke about being self-insured, or the county going self-insured to save some money overall. And I know there's a percentage that we're getting close to that would put us at that point. But when I was listening to you talk about option 4 is almost a step towards that direction.
Well, yes and no. There's no gamble in option 4. The difference in the self-funded, and we did look at it extensively this year. I'm the big stumbling block on that. I don't like to gamble with taxpayers' money. With that gamble, we could save, possibly. We might not. It's sort of like the pension plan versus the 401k. The pension plan, you know what you have. The 401k, you might make more and do better at retirement, but you might not have as much of a retirement. It's dependent on the market. It's very similar to the self-funded. Option 4 isn't that because there's no gamble in option 4. Some employees said they wanted a direct primary care, which I'm telling you, if you're young and nothing wrong with you and you got kids that go to the doctor 2 or 3 times a month, as most kids do, it's a great option. If we didn't offer insurance along with it, it would be a huge savings to the county, but I can't in good faith not tie insurance into it because there's gonna be needs for insurance in addition to direct primary care. But it is a wonderful option. Even older people like us or me, if you've not got major issues and you just go to the doctor once or twice a year for a wellness check or a cold or a COVID, whatever, direct primary care is the way to go because again, you can go as many times as you want to and have no copays. But some people, I guess, just for whatever reason, want to stay with what they got and not make changes. It will help in the long run on our claims because they're going to a direct primary care physician. Cigna's not getting that claim that we have to answer to then at renewal. So in that sense, it really helps us a lot. But the biggest difference is there's no gambling. It's still a fully insured plan. We're just offering the direct primary care along with it. Seems like someone said, it's Josh.
I just to mention and just concur with you on this. I'm one of the 14 people that go to direct primary care. My family goes there. I'm a young family that I've got 3 daughters. 2 of them see the doctors there. They have an MD on staff there. And my health journey has been pretty public over the past year or so, but I've got to say everything that I've done health wise and from all the weight that I've lost and all the healthiness and the tests and everything, if I was to go somewhere else and have to do all the blood work and all the medicine and everything like that I've done, my wife has done as well, it would be outrageous. I go once a month there and do free labs all the time. Most of our medicines are free from their program, and it's a great option for people to have. I'm a huge believer in it just because of the benefits that I've seen. So I just wanted to concur with you, Mayor, about that.
That's good, Josh. You ought to come to open enrollments. Our problem with open enrollments is we can't force the employees to come. They're working, they don't want to come. We offer them it several times, but but people won't come to enrollments for whatever reason. We can't force them to. Direct primary care wants to be in front of more people. They feel like they can sell it to more people if they were, but we can't force them to be there. So instead, they don't come and they say, leave me in the same plan. No changes, I'm happy with it. But again, if I go back to whenever I had small kids, and one of them especially was going to the doctor at least once a month. Well, even with a good plan that we have, that's $35 a month times 12. With direct primary care, it's $0. Sam's with Cigna, so he don't like to hear all this, but he understands where I'm coming from. It is a great plan for a lot of people. It really is. We finally started doing it last year because people had been asking for it, but then hardly anyone took it. It's hard to go back and negotiate with direct primary care when nobody took your plan because insurance is based on numbers. The bigger the number, the more you got to work with. I didn't have much negotiating power with them this year because nobody took it. They still feel like they can get in front of more people and hear things like what Josh just said because those are true stories. I know family members that are in direct primary care too, and they love it. Another big difference, not only do you not pay that $35 copay, which is a great copay, don't get me wrong. There's a lot of people that pay a lot more than that. But when you go for that appointment, I was talking to a family member the other day, and he said, look, there's not a waiting room there. He said, if I have a 2 o'clock appointment at 2 o'clock, I walk right in. I see the doctor. I get my prescriptions. I leave. I paid nothing, and I'm out of there in 30 minutes or whatever it took to see for the time with the doctor. So people that do it love it, but somehow we got to get more and more employees to look at it because it is a way of saving people, especially young families, a lot of money. Now, if you're never sick and your kids are never sick, then I don't guess it would save you any. But if you've got kids, they're going to the doctor every once in a while, I promise you, with viruses and so forth. But anyway, enough said on that. I'm not here to sell direct primary care, Sam, but I just wish more people would look at and consider option 4. The bottom line to the county commission, it's a 3% increase. I'll say this with Cigna sitting here, that is a good percent increase. Are they still making money? Yeah, insurance companies are in the business to make money. But keep in mind, with a fully insured insurance, the gamble's on them. And we could go through the numbers of why they gave us a 12% renewal because we're at almost 100%. Our claims are almost equal to what our premiums are. And that's not the way it's supposed to be. So again, more people take option 4, our claims will go down. But at the end of the day, they've agreed to renew at 3%. They're still making money. I have no doubt, even though they'd whine and say they're probably not. But it's a good renewal for us. Anything we can renew at 3% is good news to the taxpayers. So I'm comfortable and happy to be able to present a 3% increase.
Bobby?
I was just gonna say, I agree with Mayor Davis. I make a motion, we stay where we're at on the insurance. And, that's not too early to make the motion.
That's fine. Get a second. Get a second. Oh,
Okay, got a motion and a second. All in favor? Any opposed?
And really, I really appreciate that. I'm not wanting to cut the meeting short because now you're gonna have to go buy a cup of get a cup of coffee and drink it for a while. But please understand, from the county's point of view, a 3% increase, no changes, that's great. The only issue we ever hear from employees, they may say so-and-so's insurance is better. So-and-so's insurance is not better, I almost guarantee you that. But the only negative is the cost of the family. You take option 4, the cost of the family goes down, and your membership is included in that option 4. So remember that, because you hear from employees probably more than I do. It's a less expensive family plan. Why is there a cost there? Because we cannot not provide them insurance. They may say all they want is a direct primary care membership, and as sure as they say that, karma will come alive and they'll go out here and have a head-on collision and be in the hospital. And with direct primary care is not doing them any good in those circumstances. So we have to provide insurance along with the direct primary care. So just please understand that. 3% from the taxpayer's point of view is a good renewal. No changes to the plan is great for the employee. I'm still on that plan, and it is a good plan. But do talk up option 4 anytime you have the opportunity, because for the right people, that is the way to go, I promise you. If there's no other questions, I appreciate that. I have a resolution, since that has been approved. It's passed already, right? You got to vote. I have a resolution that I will pass out that when you go to the full commission at 12 o'clock, they'll actually be approving the resolution that gives me the authority to move forward with renewal with Cigna. Okay? Thanks a lot.
Any other discussion? Anybody? Yes, ma'am.
Thank you. Is it on? Can you tell? I just wanted to thank you. I wanted to thank you for the opportunity. I consider it a privilege to be your broker. It has been a lot of work this year. We've looked at a lot of different angles, considered a lot of different options and things for you and for the employees. Cigna's put a lot of work into it. And the mayor, I know he probably spent a few sleepless nights trying to figure out what was going to be the best thing for the employees and for the community as a whole. So I just want to tell you thank you, and I appreciate your business. And please call me, ask me if you have questions or issues, anything with claims, or if you have an employee that speaks to you that's unhappy about something, or his claim isn't being paid the way you think it should be, please have them contact me. I'm always willing to talk with them and see if we can't just figure whatever that problem is out. You're welcome to come to our office at any time up on Ocoee Street. We love seeing them. We do help this year with the enrolling new employees. They do come to our office and we meet with them. We do spend quite a bit of time with them, talking to them about each plan, including the option 4 with the direct primary care. We put a lot of effort into it the last few months in really trying to explain that plan to them, and we will continue to encourage them in choosing that plan if they feel like it would fit their needs.
Yeah, what she mentioned there about the enrollment. Now, when new employees come to us, we will sign up, get them to sign up, fill out all the papers for employment, and we'll send them straight to the broker's office to get signed up for insurance. That way they have a one-on-one, usually a one-on-one sit down with the insurance agent to explain the various options. So for new enrollees, it's not a problem. It's back to what I was saying, is the existing employees not coming to open enrollment. They're there, Cigna's there, direct primary care is there. Those people are there to answer any questions they have. If they will just come to those open enrollments and get those questions answered. And again, if someone, it doesn't happen often, but if you have a claim and there's an issue, sometimes there's a glitch in it, Cigna is messed up or someone is messed up, we'll put you in touch with the broker. They will try to figure out what it is. They'll get with Cigna and they'll get it worked out. That doesn't mean those glitches never occur, but that's what they're there for. And probably the broker is why some employees still to this day say we never bid insurance. Folks, we spent 2 months bidding insurance, I assure you. I just made it very short here this morning. But we bid insurance every year. The broker's job is to work with whoever we go with. And this year we had the 3 bids. We tried to get 4, but Aetna wouldn't bid. But we got 3 good bids, which again tells you that we're in the right range on the price. So we went through that bid process, and then they were told to go back and negotiate further because you're not within my budget yet. And they did, and we appreciate them doing that. 2 of them came back with a better price than the second go around. So the bidding is occurring. The broker isn't part of the bidding. They're the ones that handle the bidding. So the bidding is with Cigna, Blue Cross, and this year United Healthcare, with Aetna turning it down. You name another insurance company that's willing to bid, we'll make sure they get a letter next year. But that is the only 4 that has bid in many, many years. And usually it's just Cigna and Blue Cross. So it was good to have United in the mix this year. They were very competitive too, by the way. Not very different companies, but they were close in the price at least. So the bidding thing has gone, as you saw, it started back in August, and we're just now here. I'm actually a week late based on your minutes from last year, but we try to get something approved in October so that we can have those open enrollments in November, and the new plan will start then in January. One thing I want to ask Sam, try to get new cards this year. Last year, no changes, no new cards. Some people question that date on the card. So I would hope we can get new cards this year. Because in January, they'll say, yeah, this is your card. Well, there's no change. Well, I don't care. It says that it was for the year of 23, for example. And sure, if they'll call Cigna, they'll find out there's no change and it's still good, but it does cause a question to some people. So you might consider doing new cards even with no changes. Does that make sense? You understand what I'm saying? Some people do question it.
I'd be happy to address that.
Yeah, go ahead, you want to.
Yeah, well, first of all, this thing. So, and we've worked well with you guys. We have a good overall track record. Your premium increases have been very low, especially like Mayor Davis said, 3% in the face. We all know about inflation when we fill up our tank or go to the grocery store. I get shocked every time I go to the grocery store, but it's a very aggressive rate increase for you. Your 4 plans, it's impressive. It covers the whole spectrum. I'm an HSA guy. That's what works for me. You got an HSA plan. If I was in a different situation, looking at your plan, the DPC plan would be awesome. And then you have traditional plans with your choice of network. So you've got the full spectrum covered, and that's pretty impressive options for you guys. So on implementation, what we're doing as a company is we're going to automated ID cards, really across our whole company. When you think about it, that's the way things are going. A lot of people don't want plastic in their card when you've got it on your telephone. I'm going to get back around to providing what you asked.
He's still got to provide me one.
Yeah. Well, and okay. Okay, so we're going to digital, all digital ID cards January 1st across the country. There is an exception to that, and we'll pursue that and get you traditional cards. But if you think about it, it's already on your phone. If you got a MyCigna app, or you can, or on your computer, mycigna.com. Or if we were going to digital this year, maybe it'll be next year, it looks like now, but anybody who wants a card can just call 1-800-CIGNA-24. That's our customer service number, 24 hours a day, and say, please send me a card, and you'd get a card. That way it gives the best of both worlds. If you're a younger person and you can't stand anything that's not on your phone, then you don't get the card, you throw away, you know. If you've been around a little bit like most of us, and you want that physical card, you can call in and get it. But what I'll do is go for the exception, you know, and just say, let's do regular cards again this year for everybody across the board. And then maybe during open enrollment, we can explain that in the future, things are going digital just to get everybody ready for the following year, because that's where it's going to. But I hear your request, and we'll, as soon as we get approval and start the implementation process, assuming, you know, that's voted through by the full commission, you know, I'll put that request in.
All right, I appreciate it. And since we've got time, is it okay if I go back in history for the newer ones on insurance? When I first came into office, we were on the state plan. You hear about that a lot. Schools are on the state plan. Schools stay on the state plan. School state plan, by the way, is different than ours. You got a wife that's a teacher. Her plan is not the same as our state plan, but it works very similar. If I wanted to be lazy, you don't have to bid it. You just renew it every year. They'll send you a letter that first year, oh, it's going up 10%. And by the way, we lowered we increased the deductibles and so forth. You have no negotiating power and nothing, but it is easy. My predecessor spent 0 time on insurance because she just renewed with the state plan every year. And that's what a lot of people do. We started bidding it the very first year, and with 2 or 3 exceptions, we've bid it every year. I felt like it's an important thing for the employee, and also it's one of the most expensive things that we do as the county commission does, is provide health insurance. So we've bid it every year. I could easily go back to the state plan. If they submitted a renewal at 12% and at bidding kept it at 10 or 11%, I'd be calling the state to get a rate. The odds are the state would have been an increase like that also. The bad thing about the state is you got to agree to stay with them for 2 years, and next year they'll jump another 10%. I'm telling you, we've tried it, we've been there, and we've done that, and it's not a good situation. Plus, the plan changes all the time without any input from us. But in all the years we've bid it, and we have gone to Blue Cross. One year, Blue Cross was really hungry. Cigna was having some negotiating issues with a local hospital, and Blue Cross took advantage of that and jumped in with a low bid. We went with the low bid, and we switched to Blue Cross. And I told the commission at that time, Blue Cross is a good company. They're the low bid, so I suggest going with them. But a heads up, write this down. Next year, they'll have a huge increase. That's how they operate. We got the low bid. We saved $300,000 or $400,000 that year. But next year, they gave us a huge increase. So we're back. We bid it again. Cigna got it back, and they've had it, according to what he just said, the last 13 years. It's not that we stay with Cigna for any other reason other than they have always wanted to keep our business, and they've negotiated to show that. But we've been with Blue Cross a couple of times. We actually were with the insurance that Bradley Memorial created when they were still up there. What was that called? Ocoee Health Alliance. We were with them one year. From my perspective, that was really good insurance. I had $10 copays then, but nobody liked it. The bottom line is employees don't like change. So at least now we're not proposing a change, and it's dollar-wise a good figure for the county also. So, but we've been there. We've been with Blue Cross. The others have never won the bidding, so we've not switched to them simply because they've never been the low bid. This was probably the closest with United this year. I'm glad that Cigna came down and ended up being the lowest, but they had very stiff competition with United. We always have that option of going back to the state plan, and I say all that because you'll hear that from people sometimes. But you tell me, when was the last time Bradley County Schools bid insurance? They don't. They stay with the state plan every year. And I could be doing that, and my life would be so much happier. I promise you. But it's very important to the county because we spend a lot of money on it. And I'm always been on that plan. I want to know we have good insurance. I don't want some bureaucrat in Nashville dictating my changes. We've had to tweak ours a few times, but it was tweaked at the local level, not with some bureaucrat in Nashville. So I could go on and on about the state plan. The thing that's becoming more and more talked about is self-insured. We really worked a lot on that this time. Cigna gave us, through Oakway Insurance, a plan. We also got self-insured plans from 2 other agencies. We've spent a lot of time on that. Again, like I said, I'm just not to the point of wanting to gamble with the taxpayers' money, and it's a gamble. That means you can save money, potentially, but you also could cost money, potentially. With the fully insured plan, you know what the cost is, and then I'm not gambling. I'm not gambling with taxpayers' money at all. Here's the cost, a 3% increase, no gamble, and our employees have good insurance. So I'm still much, much more comfortable going that route. But the people that promote self-insured have a good argument. Well, but you could save this amount of money. Yeah, you could save that amount of money, but you might not save that amount of money. You could actually go the other way. And most people, if you'll talk with people that have done it, it's like the graph of the stock market. It really is. Some years you save money, some years you don't save money. As far as the employee is concerned, if we didn't change the benefits, which is what I looked at with self-insured this year, then the benefits don't change, so it doesn't affect the employee. It's the bottom line of the county where we could save, instead of spending that 4.7. See, we spend 4.7 for insurance. That's going up $139,000. So we spend about $4.8 million. Could we spend 4.5 by gambling with that money? Possibly. But we also could spend 5.3, and it'd be more. You follow me? And that's when you talk to someone that's pushing it, and some of you have friends that are pushing it, I know. It's not a bad thing, but you got to be in the predicament that you're willing to gamble. And I'm still not there. Call me ultra-conservative if you want to, but I'm still not there. I would rather go with the 3%. Now, if their renewal had been 10 or 12 or 15, and that was the very lowest, I can tell you we'd have probably been coming to you with a whole new self-insured plan to look at. But with the 3%, it just, in my opinion, makes no sense. So that's just a little bit, in case you come across those discussions with others. That's where I'm coming from. But I appreciate your recommendation. I'll give you the resolution to present to the full commission. Hopefully they will pass that resolution, and then we'll be announcing the open enrollments coming up in November, okay? Thank you.
Thank you, Mayor. I do have one statement myself. Everybody knows I work at the hospital, and we have Blue Cross Blue Shield. We do have great insurance, and of course my premium's not near this, and I have the family plan. And we do have a little clinic off of Paul Huff, and it's great. But getting to your self-insured, we got to remember on self-insured, in my opinion, and this is simply my opinion, you have 3 open heart surgeries out of your self-insured plan, and there goes your savings. I can promise you that. You have a treatment for leukemia, a treatment for whatever it might be, not knocking self-insurance. If that's what you want to do, that's fine. I mean, I carry my insurance at the hospital, so it doesn't really make me any difference. But 3 or 4 open hearts or any other kind of cancers that might come across, which we're covered up with different cancers, different people from the hospital, people that we know are coming down with different illnesses, and it's not cheap. Medical field is not cheap. I work in our supply distribution at the hospital, and our cost weekly, just supplies weekly, is well over $200,000 just for supplies, and I'm talking diapers but now, of course, that's surgical supplies also, the packs that we do for surgeries and things like that. Do we make money? Yeah, we make money. Do we lose money? Probably not. But all in all, thank you, Mayor, for your presentation. And I guess the other thing we need to ask for is anyone, communication from the audience. Grant, did you have anything you need to say? I know you were just getting here, so. Okay, good. But, no communication from the audience? Okay. Then, I call this meeting adjourned.
Thank you all.